Are you anxious if you go to a dental clinic? I took a break because I was pregnant and I took a break of 1 year. 1 hour, one patient, and then 1 hour of break for sterilization and then another patient. This procedure was done to one of the actresses. They save the tooth first and then, think about removing it.
Absolutely.
But I would say COVID was a blessing for me because
Okay.
I took a risk of.
Hello and welcome to Success Secrets, a podcast of its kind where we interview entrepreneurs in and around Chennai and try to learn their recipe for success. On today's episode, we have a dentist with us who's a Invisalign Platinum Elite provider, and we are honored to have her between us. Thank you, Dr. Vineesha, for joining us.
Thank you, Sankesh.
First questions first.
Yeah.
What made you choose this profession?
So it's a funny story actually. So I used to go with my grandmother when I was in 9th standard to the dentist.
Okay.
So whenever I used to go there, the clinic was full and she was always counting money. Okay, so I was kind of very interested to know, this profession looks all nice and I should become a dentist, and that inspired me. And then I started manifesting dentist, and then when I finished my 12th grade, I got a seat in Pondicherry for MBBS. But then I told my mom I don't want to do MBBS, let me do BDS, so that I've always wanted to become a dentist. That's how I went into BDS.
Brilliant. So you believe in manifestation journey as well?
Yes, actually I do.
Awesome, brilliant. Would you like to tell our audience a little bit about it? Just touch points upon it. How do you go about if somebody wants to manifest something?
So basically,
just one basic thing, yeah.
So basically, I've always believed that positive manifestations do come true, because in my life, at least, whatever I wanted, I always, every day, I have like a journal where I write down or I chant like 2-3 times a day, and it's always happened.
Brilliant.
There's no such thing that hasn't worked out till date, touch wood. Yeah.
Brilliant. Yeah, even me, touch wood, so that nobody thinks it. That is brilliant, and I hope the audiences and viewers seeing this are also start out their manifestation journey. So, Vineesha ji, what is the one thing that sets you apart, in this industry?
Okay, one thing I strongly believe is what we should provide is the quality of service.
Okay.
I'm pretty transparent in what I do. From start to finish, patients are always part of the treatment plan. So I've always, so when I used to go with my grandmother, my aunt, I've always seen that the dentists never sat down, explained things, and they were always anxious.
Okay.
So I'll ask you a question. Are you anxious if you go to a dental clinic?
I guess so. I mean, I wouldn't know what is going to happen to me. So maybe yes.
Most of them are, because they fear needles into their mouth and everything. So I've had many patients like that who are very, very anxious to sit in the chair. So I believe, at least sitting with them, speaking, if not me, I at least train my staff to be a little patient and explain everything step by step.
Okay, so it is not just the transparency, but I guess constant communication also is
constant
one of the things.
Correct.
Brilliant. So I think somewhere making the patient comfortable with communication as well as transparency helps in has helped you where you are.
Yes,
right? So that's what you call as has shaped your journey.
Correct. I don't believe in so many number of patients. We limit to 1 or 2 an hour, and we sit down and we don't rush them here there. So
brilliant.
So that is something that we try to follow all the time.
Super. So in short, quality over quantity.
Yes, correct.
Quality service over quantity
service. Yeah.
That is amazing. So how has your journey been so far? Like, can you just briefly tell us how you started, where you started, and where are we today? Why I'm asking this is because you are an Invisalign Platinum Elite provider. So I'm sure the viewers would like to know how did you come about this journey. So
right. So once I finished my undergrad, I started my post graduation in orthodontics, where we align teeth, braces especially. Okay. And then I took a break because I was pregnant, and I took a break of 1 year. during that time, I did my Invisalign certification.
Okay.
So because I didn't want to sit at home, so I took time out and I
Good.
went did the certification. And after my son turned 1 year is when I started working.
Okay.
So I joined as a consultant in a couple of clinics, but then I understood my cup of tea is, to set up my own practice and work.
Brilliant.
So I started my clinic in the year 2019,
Okay.
June, and 7 months into this, COVID hit.
Yes.
But I would say COVID was a blessing for me because
Okay.
I took a risk of, sending my son with my parents to Hyderabad, and I was here all alone taking care of the clinic.
Okay.
So we were open for almost the entire COVID lockdown period because we
Okay.
come into essential services, and many of the
Absolutely.
clinics were not.
Absolutely.
So I did maximum revenue generation, I would say, but I saw
Okay.
I helped a lot of patients come out of pain because they were all in pain, but they were looking for clinics. None of them were open.
Brilliant.
So yeah, that's how slowly, and then I introduced a lot of equipments. I got into place. So we have state of the art, scanners and X-ray machines in the clinic, which has helped us grow to this level now.
Awesome. So there are two things that I, can deduce from what you just said. So one thing was obviously, COVID being a blessing for you
Right.
as you were open. How did you mitigate risks during that COVID period? Because
So-
yours is a more
Right,
hands-on
right,
job, right?
yeah.
So
So we try to avoid, so what we call as aerosol, where the spray of water comes in. We try
Okay.
to minimize those cases as many as we could.
Okay.
And I had a very good fumigator in place. We had
Okay.
UV lights for sterilization. And then we used to clean and vacuum and keep cleaning after
Good.
every patient. So we used to see like 1 hour, one patient, and then 1 hour of break for sterilization, and then another patient.
That is amazing.
So-
So all strict protocols,
Right.
thoroughly understanding what
Yes,
needs to be done.
yeah.
Brilliant. And I guess the second thing I was gonna say is like you always probably knew the entrepreneur in you was there. It just probably came to the fore during the consulting thing. Brilliant, brilliant. So Vineesha ji, how many patients have you treated so far? And what kind of services, what you describe is your forte?
I have treated patients separately, but in my clinic, I would have treated close to 6,000 patients so far in the last
Brilliant.
5 years. And my specialty and my forte is creating smiles, aligning teeth. But the clinic is a multi-specialty clinic where we
Okay.
do everything. I have 8 doctors who are associated with me. They come in as consultants. So we do root canals, we do implants, we do from scaling till complete rehabilitation of the mouth.
Superb.
So,
You
yeah.
actually answered my next question also because I was gonna come to how
Right.
many members you have in your team, how many
Right,
doctors
right.
are there, and how many nurses are there. So why not, just ask it again. So how big is your team apart from 8 doctors and?
So my clinic, there are 2 associate dentists who are always there from 9:30 to 8:30, and I have 3 sisters and 1 front office, and we have round the clock housekeeping.
Okay.
And apart from that, we have consultants who come for various treatments.
Brilliant. I believe you also have an Instagram page for
Right.
your clinic,
Yes,
right?
yeah.
Can you tell us how many followers do you have on that?
We have close to 9,000 followers in that.
Amazing, amazing. Tell us about your top 3 or maybe one top success story, like that has a patient or a procedure that you did which is extremely close to your heart.
Right. So this procedure was done to one of the actresses. I don't. I'll. So she had something called as veneers, which was done elsewhere, and then we
Okay.
remade them because those were not. So what are veneers? I'll tell you.
Yeah,
So you
please.
see,
I was gonna say
you
that.
see this. Yeah, you see this, right?
Yes.
So you. This is a veneer.
Okay.
So the wood is like normal
The base,
wood, and
yeah.
you stick something on it, right?
Got
So
it.
that's the veneer. That's
Okay.
exactly what we do here. So
Oh.
we change the shape, size, and color of your teeth according to how you want it. So that's
Okay.
called as smile designing.
Uh-huh.
So if you're in media and you're in front of the camera, this is something most of them do because of aesthetic appearances.
Of course.
Like they want to be very aesthetically pleasing in front of the camera. So we designed for her 6 teeth, front 6 teeth. We had to
Okay.
redo it twice because she was okay. Then she went back and then she said, no, it's not okay. This, my director is saying it's not okay. Then we actually removed it. We did the whole thing again.
Oh.
So it was like a 30-day process, but end results were brilliant. And she's very, very happy right now with the results.
Amazing. So at the end of the day, that is what we
Yes,
need, customer
yeah.
satisfaction, right?
Correct.
Superb. So Vinisha ji, tell us one moment in this journey of yours from 2019 when you started your clinic that made you realize that you are on the right path.
Okay, so when you start a clinic, right, it's a new establishment
Of
and
course.
it takes time for you to get patients, gain their trust.
Mm.
So, 4 months into practice, it took 3 months for patients to start coming in, at least,
Mhm.
okay, there's something here, let's
Right.
go see.
Right.
So, fourth month into my business, I had a patient who came in for basic cleaning. Okay, so
Right.
I did the cleaning, and he said, "I'm very happy. You walked me through. I'm usually a very anxious person, and I
Mhm.
don't get my teeth cleaned that often because I'm scared of that sound."
Right.
So he was very very happy with the treatment, and I was very happy that day. So the next day, he comes in with his
Mm.
wife and his mom to that was just
Okay.
a scaling treatment. He comes in, his mom needed a lot of root canals and a
I
couple of
see.
partial dentures. His wife needed alignment of teeth. So that's when I realized, if you actually give it your best, you can definitely make it in this field.
Brilliant. So you showed some care. You walked them through the process, and that's what led
Yes,
you,
yeah,
get more
again,
customers
yes,
and also
yeah,
gain the trust of the
right,
client.
yeah,
Can we summarize it that way?
yeah, they're still my patients, so yeah.
Brilliant, brilliant. So let's say Vinisha ji, probably a 13 or 14-year-old kid is watching you right now. So
Right.
what is the one piece of advice that you'll give them?
So I see a lot of teenagers who are very conscious to smile these days,
Mm-hmm.
and it really affects their self-esteem.
Okay.
So I would always say that don't give up in life. There's always a time where everything will change and things will fall in place for all of us. So
Right.
it's never too late for anything, even to
Always.
uh, get. So my oldest patient is 68 years old. She's had that child trauma where she had
Mm.
forwardly placed teeth, and she said, right now I really want to get it done because it's been my lifelong dream to align my teeth.
Okay.
So we should always work towards what we want. I'm not talking about dental alignment,
Of
but
course. Of
anything in
course.
life we should never give up. That's what I would always say.
Brilliant. That is a brilliant piece of advice. So perceive, just go after what you want, and I think along the way you always find your passion.
Correct, yes,
And you will know what your calling is.
yeah,
Can I put it that way?
yes, yeah.
Amazing. So Vinisha ji, can you tell us about the vision of your clinic, and if you have a mission as well, and how do you go about it?
I want my clinic to be a private practice where
Okay.
I'll not expand it and make it too commercial. It'll always be a private practice, but it's always been my vision to have two more clinics. One is for the needy,
Mm-hmm.
where I don't want to charge them anything and do service, and the other
Brilliant.
is for other. I want to open a very niche place just for
Mhm.
Invisalign. So there are two
Brilliant.
extremes, but I want to do them both. Yeah,
Oh, well, you're balancing both of them
right.
very well, and that is so noble of you to think about, setting up one for the needy. So, Vinisha ji, what is one misconception about your industry that people have generally?
Okay, one misconception is they feel dentists are very expensive. Okay.
We'll come back to that topic. No, I'm not talking about you or this. It's just a joke. Because
Right.
sorry, I'm interrupting here.
Hmm.
I know people in the Western countries, or at least NRIs in the Western countries, they always prefer to
Coming to
come back
India,
to
yes,
India,
yes,
get
yeah.
their
Yeah,
dental
sometimes.
treatments done, and
Yeah,
then go
yeah.
back. They say it is far cheaper to
Cheaper.
pay there, to come here and pay for
Yes.
the flight tickets than to pay over there.
Correct. So true.
So yeah, please,
But we
misconceptions.
Indians, we still feel, our dentists are more expensive. But
Hmm.
that is one. Second, they feel that, we tend to recommend unnecessary treatments. I'm not
Okay.
very sure. It's a very generalized this thing that I've seen in multiple clinics where
Yes.
they keep second guessing, do we have to do it? Like you say, you require a
Absolutely.
root canal, your, teeth are not okay, get it done
Hmm.
because sooner the better.
Absolutely.
Once you go to a stage where there is no rectification or salvaging the tooth, then we'll have to remove it.
Of course.
So we always say save the tooth first and then think about removing it.
Absolutely.
So that is one thing that I always feel that patients think that we try to tell them unnecessary treatments. Okay, so I think that is one misconception where people also neglect dental health. They
Oh,
feel
chalta hai.
doesn't
Yes.
matter.
You're right. Awesome, awesome. And Vineesha ji, what has been like, how does your practice impact people's life? If I can ask that.
See, one thing that we mainly do is create smiles. That's why I chose
Hmm.
this field of dentistry. There are like
Right.
9 specialties. I wanted to do this because each case is different. Not
Okay.
everybody will have the same set of teeth or
Right.
same issues. Some people will
Right.
have crowding, some people will have forwardly placed teeth, gaps,
Hmm.
or so I feel that smile that they have once everything is sorted is something that gives me joy.
Superb.
That is one. And second, I try to do a lot of pro bono work where I don't charge people who come from down south where
Okay.
they really can't afford treatments and
Right. Proper dental care,
proper
basically.
dental care. So I try my best at least for a couple of them if I can do something.
That is so noble of you.
So
I
that
think
is one.
this act of service, I'm sure it's going to come back to you in much bigger and much larger ways, because we believe in what goes around comes around.
Yeah.
So that is fantastic. So what is one surprising lesson that you've learned in your journey as an entrepreneur, Dr. Vineesha?
To be very patient. I
Nice.
am not I never used to be a very still I'm not a very patient person, but
Mhm.
this journey has taught me to be patient in life.
Okay.
That's when things will happen.
Good.
So that is one great lesson of life that I've learned.
Superb. So patient கிட்டே patient இருக்கணும்.
எல்லார்கிட்டயுமே patient ஆ இருக்கணும். So
Oh, that's just joke.
that
But yeah,
is
that's
one, but
amazing.
yeah.
Brilliant. And one last question before we wrap this up.
Yeah.
What keeps you motivated?
So somehow I just love what I do. So
Awesome.
I wouldn't say something is keeping me motivated. I'm just generally, I really want to do this. This is something who I am. So
Right.
I really can't step back or not do it.
Awesome. So basically, this is what you love.
Yes.
This is what
Yeah.
you're doing. So there's no need to motivate because this is what you're meant
Correct.
to do.
Yeah.
Awesome. Brilliant. That is very well answered. I think it was brilliant knowing about you, knowing about your
Thank you so
journey,
much.
understanding what you do. So thank you so much, Dr. Vineesha, for being on this episode and enlightening our viewers. Any parting thoughts? Anything you want to add?
Thank you so much for having me. And
Pleasure.
I would always say, so like my son says, he says, never quit. And he's a big fan of Ronaldo. So I feel,
Nice.
so he also keeps me motivated. One factor, because he always tells me, Amma, I have to do this, I have to do this, and he gets it done.
Awesome.
So yeah, that is something.
It's like we are supposed to teach kids, but we as
Right.
parents, we know that the kids end up
Yeah,
teaching us so
yes,
much
yes,
more.
true.
Not just about how to stay motivated, but I guess patience and
Yes.
so many other things. So
Yeah.
thank you
Thank
to
you
your
so
son
much.
as well for rekindling all of
Right,
that,
yeah.
and really appreciate that. Thank you, Dr. Vineesha, for
Thank you so
coming
much.
on, and it was a pleasure talking. So yes, that's the end of the episode. Thank you so much for tuning in and supporting us. We'll see you next time.